Thank you, Dr. Vaishnavi and Sahani sir. Good evening, good afternoon, and good morning. This is the 1462nd day of continuous webinar conducted by International Forum for Promoting Homeopathy. We welcome all to this session. Today, our guest is from Nagpur, Dr. KAVITA Chandak. Let us begin the session with 1 minute silent prayer. Thank you all.
Dr. Kavita has joined and make him the co-host.
Yes, sir. I am the host, sir, and Dr. Kavita is the co-host now. Yes. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. As already the Hindi session is over, the first session that is from 7:30 to 8:30, and we will have another session from 8:30 to 9:30 at the international level. That is the uh, in English session, and 9:30 to 10:30 we have local language session in Malayalam. All these sessions are going well. We just celebrated our 1004th. We just celebrated our 4th anniversary just 2 days ago, and this is the second day of the 4th year. So, as you all know, that today we have a guest from Nagpur, Dr. Kavita Chandak. She has completed her MD Homeopathy and PG Homeopathy from London and PhD from France. And she is a consultant physician at Nagpur, and she has more than 23 years of clinical experience. Dr. Kavita is a passionate young homeopath honored by 4 Golden Book of World Records by treating kidney disorders and success in cases of mucormycosis. She is the author, international trainer, speaker, promoter of homeopathy, practicing since 1999. She specialized in autism, psychiatric and behavior disorders, kidney diseases, and cancer. She is an advisory member of Turkian Kilansi Journal in from Istanbul, and is a scientific committee member at Duas University, Turkey, and LMHI 2022. She is invited to as a speaker in many national as well as international conference and seminars. Recently, she spoke in New Zealand, Russia, Greece, America, Romania, LMHI 2023, and HMAI Delhi and Indian conferences. She has authored 8 books: Health versus Diseases, Homeopathic Guide for Many and Busy Practice, Healing Woman and Homeopathy. Homeopathy is fun, dedicate, and learn. Homeopathy is logic and magic. OCD, hypochondriasis, and depression. Homeopathy has an answer. 7, psychiatric diseases, causes, and cases. And 8, uncover my mystery of schizophrenia with different homeopathic approaches. And she has written a Spanish book, Understanding Women Through Homeopathy. She wrote more than 300 articles in different languages. That's a great thing. She is doing online courses, how to master psychiatry with homeopathy, womanhood, a power pack homeopathic solution in all disorders, including cancer, homeopathy and autism in and out, homeopathy in clinical practice, creating a a healthier society through homeopathy, practical application of miasms in practice. All these things are very, very important to promote homeopathy. And she has won many awards, and particularly the excellence in 2023 from Hafti. Today, Dr. Kavita Chandak will be discussing about how homeopathy saved a frustrated mother from committing suicide. You know, there are mothers who suffers because of their children. And today, as Dr. will be discussing about a case of autism, I think, and let us proudly welcome our young dynamic Dr. Kavita Chandak to this stage. Welcome, Doctor.
Thank you so much, sir, and thank you for the introduction. First of all, let me congratulate you on completing your fourth anniversary. So, I think I'm the first or second person after this New Year celebration to be here to talk. Now, I'm going to share my screen with you all, and let us enjoy a beautiful case without wasting our time.
Yes.
Yeah.
Yes, it's visible.
Yeah. Sorry, I have to go. Okay. So, my dear friends, today I am going to throw the light on the topic how homeopathy saved a frustrated mother from committing suicide. In our day-to-day practice, many of the times we have lot of patients talking about suicide, depression, and so many things. But what happens when a mother has to handle a child of autism? You cannot see them. My 90% practice is about autistic and ADHD children, how they behave in my chamber, how they make a mess, how they trouble their parents. It's really difficult. Hats off to such parents, such families who are really handling these kids with patience. But as a doctor, as a homeopath, it's our duty that we should also help them. Because I guess in treating children, child is a difficult patient for a doctor, especially for a homeopath, because they cannot tell you about their emotional status, about their mental feelings and sensations. You have to rely on the objective case taking, the data, whatever you can collect from the family, and what is your observation. So it is really difficult to handle such cases. And I am handling patients of autism almost from 80 countries. Sometimes I actually forget the name of the patient because all patients, the age group for autism is almost same. Today I am going to share my favorite case, an obstinate case of autism treated with a rare remedy. It's not like that I use only rare remedies. I use even common remedies, but it depends on the patient which remedy comes up. A mother consulted me for her 2.5 year son. He was a diagnosed case of autism and ADHD. This was the report which they performed in August 2021. That time he was 2 years old and he has been diagnosed with pervasive developmental disorder, that is PDD. But the main, PDD is now not considered as a different disorder because according to DSM-5, all the types of autism are under one diagnosis, umbrella diagnosis of ASD, autism spectrum disorder. So this was the case of ADHD as well ASD. Mother said he born 3-4 weeks early, premature. I suffered from bleeding, hence cesarean section was performed. His birth weight was 3 kg, absolutely fine. Pediatrician said his development will be sluggish. I couldn't breastfeed him due to lack of milk. Dentition and walking was normal for the age. He has speech issues, can utter the word Papa, but doesn't understand the relation. For him, Papa is just a word. He doesn't call me mom, points finger to an object if he wants it, but couldn't speak. Till the age of 18 months, he was able to talk, gradually lost his speech. This is the characteristic symptom of PDD. In PDD, you will always get the same comment to hear from the parents, and they will tell you one thing that, doctor, my son or my child, all the things were good. His milestones were good. He grew up well. But I don't know what happened at the age of 18 months, and gradually he started regressing. When he was 2.5 years old, relatives told me that he is not responding well. I thought he is weak. If we call him by his name, Shaurya, he doesn't respond. If I ask something interested to him, he answers. For example, Shaurya, do you want chocolate? He says yes. Once there was thunderstorm, but he was absolutely fine and laughing. No fear at all. He doesn't understand the risk factor. He is restless, cannot sit at one place, and does not sleep. Jumps 1,000 to 2,000 times per day. He jumps in bed for hours. He wants us to watch and clap, cheer for him. Appreciation desire. Wants open places. Hurts people by throwing things. Is comfortable only with gents, not with the ladies. Doesn't respond if we call him. Cannot express if needs anything. Cannot tell about tea. If I ask him, he says yes, but will never tell by himself. Passes stool in panty, cannot unbutton the pant. He becomes destructive if things go against his wish. Tears paper. Anger contradiction. He broke TV set. If his sister comes to me, he bites her. He feels that it's only my mom. Sleep is restless, constant moving in bed. He sucks thumb as soon as he sees blanket. Sometimes put blanket on his sister's body and sleeps on that. He is quite irritable, banging head on floor at any contradiction, crying for hours, like spicy food, loves to play in water, even watering the plants in garden, many times in a day, not only once. Stool occasionally hard. Constipation or diarrhea or any abdominal issue is a quite common symptom. In 90% cases, autistic cases, you will get constipation there. And not the simple constipation. The parents will complain that, doctor, my child is passing stool once in a 3 to 4 days. And sometimes I even have the patient who is passing stool once in a week. No desire at all. Later on, she said he has excessive thirst. He may drink small or large quantity, drinks even during sleep. His vertex and forehead sweats a lot. His neck wet when he wakes up. Family history, elder sister is normal. Father is quite introverted person, talking to himself and lack of confidence is there. About mother's history, just listen the video carefully. It is subtitled, you can read.
त्याला जे करायचं ते करू द्यायचं रिलॅक्स नाही माझ्याकडे पोरं येतात तिच्याकडे ते एन्जॉय करतात मला खूप आवडतं पोरं खेळलेलं जे भेटत आहे पहिल्या मुलीने खूप त्रास दिला होता ती बदमाश होती तर मला बाळ नकोच होतं अच्छा पण घरच्यांच्या प्रेशरमुळे मी दुसरं बाळ जबरदस्ती तुझ्या मागे लागले की तू प्रेग्नन्सी ठेव तर मग मी विचार केला की बा हे कसं भूत वेताळासारखं आपल्या मानेवर हाकललं तरी येऊन बसतेच एकदाच सेकंड चाईल्ड करू जे होईल ते पाहून घेऊ बा असा विचार करून मी म्हणजे आपण कसं म्हणतो डोळे बंद करून विहिरी थोडी मारतो तशी विहिरी थोडी मारल्यासारखी केली ऍक्च्युली हा मुलगा झाला ना मला खूपच नाराजी झाली मला मुलगी पाहिजे होती बट ऑलरेडी यू हॅड वन डॉटर हा पण नाही मला मुलं आवडतच नाही त्याला मला का माहिती असं वाटते की मुलं चांगलंच नसतात
You see here, mother was not ready for this pregnancy. She kept this pregnancy under the pressure of family. And she said, family was like a Dracula sitting on my neck. So I had to surrender. During pregnancy, I was not happy, not sad, just neutral. This is the report of the child which they made at the age of 2 years and 9 months. And it showed delayed speech, selectiveness in response, and solitary play. There were issues regarding general processing, visual processing, and oral processing. So you can see the typical symptoms of autism. I considered few rubrics here, like mind, speech, inarticulate, then mind, taciturn, mutism in children, mind, fearless, mind, jumping in children, mind, desire to be flattered, mind, cannot express oneself, mind, anger contradiction from, possessiveness, irritability even from the slightest contradiction. Loves water, impulse to jump, jumping, perspiration of scalp. From the chapter neck, I considered perspiration. From stomach, I considered thrust extreme, stool hard, sleep restless from bodily restlessness, and from the chapter food and drink, I took the rubric desire spices. And when you search the rubric hyperactivity in the children, repertory redirect you from the chapter mind to chapter general. And then you get this rubric energy, excess of energy in children. So I considered all these rubrics and many remedies like sulfur, phosphorus, agaricus, tarantula leaves, ignatia, sepia, lycopodium, as well as stramonium came up. Now, there is a problem whenever we put symptoms in the repertory, all the polychrist remedies you will get in the first few positions in the chart. But the real twist is here how to select the medicine because you are getting the whole chart only after by putting your rubrics, right? Sometimes your rubrics may be similar, may be repetitive, may be wrong. You will get the set of remedies in the same manner whatever you put in the repertory because repertorization is a mechanical tool. None of the above remedy covered gross rubrics. So I was not happy with these remedies. In such condition, we usually put Nozod, but there was no history of toxin exposure during pregnancy, not to the mother and not even in the father. Hence, this point also ruled out. So I couldn't put Nozod in this case. Now, analysis and evaluation. How to analyze this case? During interview, I understood that I'm talking to a disappointed woman who bear this child against her will. She could not accept the child as a boy even after labor. But today, she came to meet me with her autistic child with a ray of hope. Ultimately, she is a mother. My need was a remedy which should cover child's present complaint and mother's symptom during pregnancy. You know, for autistic cases, especially for autistic and ADHD or any pediatric behavioral disorder cases, we always take into consideration the mental emotional status of mother during pregnancy because long-term experience in dealing autism has taught me one thing that our medicine for such cases should be the combination of child's current symptom and the symptoms of mother during pregnancy. Now, do you have any guessing for this case? I have given you the upcoming remedies. You all know the remedies. Now, which remedy from your side you would like me to give this child? Please put your opinion fast in our chat. Stramonium. Thank you so much for the input. Sepia. Okay. Anybody else? I gave the remedy Falcon P 1 m 1 dose here. Falcon fur is a bird remedy. I gave this remedy. I tell you why. Falcon stood on 50th number in my repertorization chart. When I applied the filter graphical result by strategy in radar software, Falcon came up along with anacardium and auramate in small remedies. See, if you will see in the small remedies here, you will see Falcon P is present on the number 6. Usually polychrist remedies cover many symptoms in each patient as they have multiple symptom bands. Small remedies cover those symptoms which are the unique symptoms of the individual. I chose Falcon as it was the most suitable match to mother and child symptoms. A long experience with autistic cases, as I told you before, taught me that while dealing autism, we must see the reflection of mother in child and vice versa. Consider the current symptom of the child and past symptom of the mother. Now let us see the symptoms of mother in Falcon remedy, which I got in Falcon. Mind, delusion, he is trapped. Because she was trapped in that family, she couldn't go back. She didn't want the pregnancy, but ultimately she had to follow the family rules, customs, and their commands. Delusion that she is betrayed. She told me one thing when I took her history, that before marriage, she thought her husband had a good job. But after marriage, she came to know that he was not working at all, no job at all, no income in the family. He was dependent on his father as well. He was around 12 years elder than her. They hide his age even before the marriage. The next symptom I considered from the mother was ailments from anger suppressed, ailments from shame, ailments from being scorned, contemptuous, delusion, he is persecuted, delusion, unsupported, injustice cannot support but cool in the face of injustice. The lady, she said, I cannot support this injustice, whatever injustice they did with me. But you know, for my child now, I have to bear everything. And that's why she became cool in the face of injustice and tolerated everything just for the sake of the child. And if you will see, this rubric, this symptom is present only in one remedy, that is Falcon P. Loathing oneself. Then patient was quite optimistic. The mother was quite optimistic in spite of the weakness. Though she knew that my child is in autism, I do not have the way to go back, but still she was optimistic and she came to a homeopath with a ray of hope. And I considered one more symptom, that is truth, telling the plain truth. She explained everything truly, honestly to me, that I didn't want this child, but I had to continue this pregnancy. Falcon P, our patients are quite courageous, strong, and extremely agile birds. There needs to be more freshness and more air and space around. That's why they keep on flying all the time. They have such strong legs. Once they start flying on the ocean, in one go, they can even cross 600 kilometers distance. So the legs of all the bird remedies are strong, that as we all know. Now, let us match the child symptom coming from the Falcon remedy. Anger contradiction from biting, concentration difficult, cannot fix attention. Danger, lack of reaction to danger. No fear about thunderstorm, nothing. The situations, the conditions where normally the child responds in a different way. The children respond in different way. But this child was totally, there was no reaction to the danger. And depersonalization. He was detached, he was depersonalized from his surrounding, from his life. Longing good opinion of others. When I jump, you have to cheer me up. You have to clap for me. Then rage with biting, mind restlessness, mind tossy-turn, and loves water. You know, loving to water is a common symptom which I observe in my clinical practice in almost 90% of autistic cases. Now, see the follow-up after 3 months.
पहिले कसं हो म्हणता येत होतं
हाँ
आणि त्याला जर करायचं नसेल तर तो शांत राहत होता. आता तो नाही म्हणतो.
नाही म्हणतो म्हणजे त्याला जर करायचं नाही तर त्याला समजतं की म्हणजे नाही बोलणार आहे. तू 3 शब्दांचं काही सेंटेन्स येतं का त्याला?
एकदा बोलावतो तो फक्त मी बाहेर जातो.
म्हणजे आता त्याला सेंटेन्स मेकिंग यायला लागलेलं आहे आणि कोणत्या वस्तूला काय म्हणतात ते पण कळत आहे आणि सोबत त्याचं नाव किंवा स्पीच क्लिअर झालेलं आहे. This time she said his speech is much better than previously and he is able to form the sentence of 3 words. Now what should be our prescription at this moment? Should I continue with the same remedy? Or should I change the remedy? Should I keep the same remedy but with different potency? Yes, doctors, come on, it's an interactive session. Same. Thank you, Tessie. Somebody says repeat with higher potency. Okay. And somebody said placebo. Placebo is the correct answer. I didn't prescribe anything because case was going in a good way. And secondly, I already used high potency in the first dose. So I decided to wait and watch. What happened? Okay. Now follow up after 6 months. Mother said he's still playing in water. If I try to pull him out, he relaxes, his body becomes loose and then throws out the things. He wants to plant water 10-15 times so that he can stay in water. I asked mother, did your doctor anytime tell you that you have inadequate water in your uterus during pregnancy? She said no. Shaurya born with cesarean section. It was a breech presentation. I said, when he born, was his neck surrounded by umbilical cord? She said yes. Why I asked this question about this amniotic fluid level? Because I wanted to confirm about oligohydroamnion as the remedy amniotic fluid stuck in my mind. I thought that he loves the water and the tendency of water is continue either stagnate or running here and there. So I was thinking the remedy amniotic fluid for this child at this moment, but I couldn't prescribe it here because there was no history of oligohydroamnion. Now what should be the prescription at this moment? It's 6 months and I gave only 1 dose. What should I do now? Come on, help and solve my case. Placebo. Okay. Thank you, Dr. Vishal. Anybody else? Okay. You saw here, she complains that hyperactivity is there, throwing the things out, and ultimately loosening his body, relaxing his body, playing with the water. So this is the time for the second dose. Correct, Tessie. This is the time for the second dose. It was not the time for the placebo, and hence I prescribed Halcon per 1 m, 1 aqua dose. This time I gave the dose in aqua, in water potency. Now, on 3rd November 2018, they did the test of CARS test as per my suggestion, and the total score of the CARS was 29. 29 is considered as no to minimal autism. Follow up after 8 months.
आम्ही जेव्हा टेस्ट केली यांची कास्ट टेस्ट तर तेव्हा तो त्या सरांशी रिलेट केलं त्यांनी क्वेश्चन आन्सर विचारले सरांनी तर त्यांनी सांगितले तो बसला पण अर्धा तास बसला आणि कसं सर म्हणत होती की हा पहिला पेशंट आहे का ज्याने इतक्या लवकर इम्प्रूव्ह केलं पण मी त्यांना नाही सांगितलं की मी होमिओपॅथी देत आहे म्हणून
का नाही सांगितलं
नाही मॅडम सांगितलं नाही त्यांना
बरं पण त्यांना एकदा सांग.
This is the tragedy. Patient visits us, gets significant results from us, but they do not like to share it with allopath because of the fear of criticism.
सोनाली की आम्ही याच्यासोबत होमिओपॅथी सुरुवातीपासून दिलं मला जवळपास 6 महिन्यापासून आम्ही होमिओपॅथी देता म्हणून सांगताना
कॉम्प्लिकेट करायला लागलेला आहे म्हणजे आपण
Father said nowadays he understands if we discuss anything, he puts his input. He's giving his opinion in the home. Now see the follow-up after 9 months. I just gave him placebo in that follow-up.
सोनाली, आज अभी कौन सा महीना चल रहा है? अप्रैल चल रहा है, अप्रैल 2022, ठीक है। अपन ने शौर्य का अगस्त 2021 से ट्रीटमेंट शुरू किया है, तो अभी इस समय उसका स्पीच कैसा है?
स्पीच त्याला पूर्ण आलेला आहे मॅडम.
अच्छा,
त्याला पूर्ण कॉम्प्लेक्स पण सेंटेन्स बोलता येते, सगळं बोलता येते
आणि क्लॅरिटी?
क्लॅरिटी पण आहे त्याच्या शब्दांना.
बरं, ठीक आहे.
आणि
आणखी
शाळेमध्ये पण जातो. पहिले तर तो स्टेबल नव्हता शाळेमध्ये, बसायला नव्हता बघत, पण 15 दिवसामध्ये तो स्टेबल झाला आणि आता तो 2 तास शाळेत बसतो.
बेड टाईप जगह पे.
हो.
आणि शाळेत असताना तो फिमेल टीचर सोबत सुद्धा व्यवस्थित वागतो?
हो, व्यवस्थित वागतो. आणि त्यांनी 10 दिवस शाळा पूर्ण वेळ झाली तर त्यांनी 3 पोएम लर्न केला.
3 पोएम लर्न केले?
हो. मॅडम म्हणे तो ट्यून पकडत आहे म्हणे पहिले, आणि मग नंतर त्यांनी शब्द कॅच केले. आता त्याला शब्द व्यवस्थित येतात. पहिले थोडे शब्द कमजोर होते, पण आता क्लिअर झाले त्याचे शब्द.
बरं.
एकूण एक शब्द क्लिअर बोलतो.
बरं. मध्यंतरी तुला सगळ्यात जास्त त्रास होता की हा वस्तू फेकत आहे आणि थुकत आहे, मारत आहे. अभी
आता वस्तू फेकतो तो, पण खेळ करायसाठी, कोणाला इंज्युअर करायसाठी नाही.
ओके. आणि
मारणं बंद झालं त्याचं, आणि थुकणं म्हणजे एखाद्या वेळेला थुकलं तर थुकलं, असं थुकणं बंदच झालं त्याचं. एखाद्या वेळेला त्याला वाटलं तर थुकलं.
आणि सगळ्यात जास्त मारताना तुलाच दिलेला आहे. पायावरती मारत होता ना मधात, आता तुला मारत आहे का?
नाही.
अभी अच्छा रह रहा
आता चांगलं राहतो.
Now what should be the prescription at this moment? I just prescribe what? Yes, somebody. Dear Ridhima, I already explained why I chose Falcon. Did you not see how I matched the symptoms of mother and the symptoms of children from Falcon remedy? And second thing, I cannot talk a lot about drug picture of Falcon because it is out of syllabus, which you can read anywhere. It's a mater medica. But if I will talk about it, then we will finish our time and I may not be able to complete my presentation. I'm so sorry. Okay, there is answer. Placebo. Okay. Dr. Piyush said placebo, and it is the correct answer. Thank you, Dr. Piyush. Now see the follow-up after 11 months.
सोनाली, अभी अपने को इसको दवाई शुरू करके काफी महीने हो गए बेटा, यानी तकरीबन एक 10-11 महीने तो अब हो गए हैं. तो तुम शुरू में जब आई थी तब इसके बालों का भी एक प्रॉब्लम था. क्या प्रॉब्लम था बता?
त्याची केस अशी प्लास्टिक सारखी वाटत होते, असं वाटत होतं की नकली आहे.
अच्छा.
असं चमकायची ना, कोणाला वाटेल की टच करून पाहिलं की प्लास्टिक आहे बा, असं वाटत होतं.
अच्छा.
आता त्याचं पुष्कळ म्हणजे 90% केस चांगले झाले.
तर आता तू टच करते केसांना तर कसं वाटतं?
म्हणजे थोडे सॉफ्ट होत आहे.
आता नॉर्मल दिसतात केस?
नॉर्मल दिसतात.
बरं. स्पीच कैसा है उसका अभी?
स्पीच खूप चांगला आहे.
सब बोलता?
हो, सगळं बोलतो.
खाना माना मागता?
हो, सगळंच ना, बनवून मागतो. हे नाही पाहिजे, ते पाहिजे, त्याच्यासोबत ते पाहिजे, लोणचं दे, पापड दे.
ओ माय गॉड.
सगळं पाहिजे असते, मिरची तळून दे.
अच्छा, यानी खाने का पूरा सेंस है?
हाँ, पूरा
Okay.
सेंस आहे.
You see, that's why we suggest hair analysis test to diagnose autism, because usually the autistic children have plastic-like hairs. Now, what should be the prescription at this moment? Everything was going well, so I just went with placebo. This is my favorite homeopathic remedy. Now see the report after maybe this was 11 months, so it may be around 13 months.
सोनाली, सबसे पहले तो ना मैं तुमको कॉम्प्लीमेंट दूंगी कि आज तुम बहुत सुंदर दिख रही हो. मेरे को लगता है बच्चे का ऑटिज्म का तेरा स्ट्रेस अभी खत्म हो गया है, इसलिए तू अच्छी दिखनी शुरू हो गई. चलो, अभी मुझे बताओ कि इसमें नया क्या इम्प्रूवमेंट है?
मॅम, म्हणजे तो खूप हुशार झाला. म्हणजे तो कोणाला टीज करतो, काही करतो, पण पकडलं नाही जात.
ओके.
असं करतो. आणि त्याचं कसं बिहेवियर वगैरे वाढलेलं आहे, चांगलं झालेलं आहे. आणि त्यावरती कुठे काय केलं पाहिजे.
टीजिंगचं एक एक्झाम्पल दे मला.
म्हणजे तो ना क्यू मध्ये उभा होता
हम्म.
तो नाकातलं शेंबूड दुसऱ्याला लावत होता
हा.
केसांना.
हम्म.
त्याने मागे बघितलं तर तो असं बघतो की मला माहितीच नाही कोणी लावलं.
अच्छा.
हा म्हणजे तो म्हणजे टोटली निघून जातो आणि त्याला क्वेश्चन्स वगैरे पण कळतात, डिमांड कशी करायची, कुठे घेऊन मागायचं, काय नाही करायचं ते पण कळतात.
त्याला पैसे समजतात का?
हो, पैसे कळते, त्याला पैसे द्यावे लागते, पैसे कमवावे लागते पण कळते.
ओके, व्हेरी गुड. चलो बघ सोनाली, आपण याचं 16 ऑगस्ट 2021 ला ट्रीटमेंट सुरू केलं आणि आज जवळपास किती आहे, 21 नोव्हेंबर 2022 आहे. त्या दरम्यान खूपदा तुझे गॅप पण झाल्या, तर त्या हिशोबाने आपण एक्झॅक्ट 1 वर्ष समजू आज.
नाही मॅम, तो आता टोटली नॉर्मल आहे.
So the mother became happy because the child is absolutely normal. Let me tell you one thing. Whenever you attend any webinar, seminar, anything, seminars or webinars are not just for collecting or listening the information. It is for interaction also. As well, you should collect only points from the teacher and you need to understand those remedies from different remedy cards. Here I am sharing a small secret of mine with you. I always read one remedy from almost 10 to 12 remedy cards, and then I make my own notes, which I usually teach in my international, national seminars and webinars. So please do not rely or be dependent on the teachers. Teachers are there to show you the path. You have to work hard for yourself. So in this case, the takeaway was patient is still under my medication. I just prescribe for acutes. It is important to know where to stop. Because once you gain the confidence of the patient and his family, they keep on visiting you for a long time. And they want you to give something to the child, to give something, not even the child. I have a lot of adult patients who are visiting me since years without any specific trouble. Just give them placebo because it is important to know where to stop. Don't forget, homeopathic medicines can create the disorder which they are efficient to cure. China, the proving of China taught Hahnemann the effects of malaria, how malaria developed, and finally he cured the malaria with the same remedy. So homeopathy works in both the dimensions. So please do not prescribe so many medicines to the patient after you got the desired cure. Now you have to listen the statement of the mother which she gave me one day when she came to visit me casually, not for the follow-up.
बेटा, अभी तो आपका बेटा ऑटिज्म में ठीक हो गया सोनाली, पर जब ये ऑटिज्म में था आज से 1 साल पहले, तब तुम्हारी क्या फीलिंग्स थी उसको लेकर?
मला तर कधी वाटलं नव्हतं का हा ठीक होईल. आणि मी थेरपीला जायचे, तिथे पण कोणी ठीक झालेलं नव्हतं. तर त्याच्यामुळे मला काही अशी अपेक्षा नव्हती आणि सर पण म्हणायचे नाही की बा ठीक होईल, ते कधीच म्हणत नाही. ते फक्त म्हणतात की तुम्ही थेरपीच करा.
पण तुला स्वतःला काय वाटायचं की
मला
मी काय
असं
करू?
वाटायचं की मॅम सुसाईड करणं हाच एक उपाय,
स्वतः सुसाईड करणं.
स्वतः त्याला घेऊन, कारण की मी नसल्यावर त्याला कोण बघणार आहे.
तर त्याला कसं मारायचं असं तुला वाटायचं?
मी खूप वेळ विचार केला की त्याला पकडून मी गेली तुझी माझी, कारण की त्याच्याशिवाय पर्यायच नव्हता माझं सगळं का हा ठीक होईल. मी जर सुसाईड केलं तर त्याला कोणी पाहणार, त्याचं लाईफ खूप खराब झालं असतं.
पण या विचाराचा तुझ्यावर काय परिणाम झाला?
भयंकर मानसिक ताणातून गेली मी, भयंकर टेन्शन मध्ये. मी झोपली तरी मी माझ्या डोळ्यातून अश्रूच पडले जायचे, पूर्ण उशी येऊन जायचे.
आणि स्वप्नात काय बघितलंस यावेळी?
का स्वप्नात मला कधी जायचं की शोधून म्हणायचं मम्मी मी माझी काय चूक, म्हणून मला इतकं धक्कन व्हायचं की मी माझ्या बाळाला कसं मारू शकते असं वाटायचं.
तुझे ते बोल के मुझे डरा दिया बेटा.
नाही मॅम, खरी गोष्ट आहे. आणि या त्रासातून जो जाते ना, त्याचा तुम्ही प्रेम विचारच नाही करू शकत, करूच नाही शकत. तुम्ही ट्रीटमेंट करून ना म्हणजे खूप मोठी गोष्ट आहे.
चल बेटा, थैंक यू। और ऐसा थॉट अभी लाइफ में कभी दोबारा नहीं लाना।
नाही मॅम त्याची गरज नाही.
You see, this is the common scenario with lot of patients, not only from the autism family, but lot of other disorder patients also suffering from suicide. And that's why even in repertory, we have the rubric driving crazy or suicide. You know, because of the pain, because of the suffering, patient try to commit suicide. And we, being homeopath, can save them. So thank you so much for this session. I tried to finish all these videos and sessions during the given time frame. This is all about my books, which Dr. Dhanesh has already told you in my introduction. But now I club all these 5 books, Homeopathy is Logic and Magic, and about OCD, psychiatric diseases, and delusion, and uncover the mystery of schizophrenia under one heading, that is Coffee with Kavita, coffee table book. And this is Health versus Disease is my different book. This book, Healing Woman with Homeopathy, is published by BGen. It is about gynecology. You know, to be a good homeopath, good doctor, we first need to be a good human being. And to be a good human being, our knowledge, our vision should be broad. For that, friends, we need good friends, and books are the best friend of human being, as I believe today. I do not like to read my books in laptop or in Kindle. Even like old fashioned, I'm still reading the books, underlining the notes, and making my own notes. Thank you so much for your patience listening. Now I am here for all of you. If you have any question, please ask me.
Yes, it's really a very good session indeed, and you really show the beauty of homeopathy through this case. And as in the writing, as it really saved the mother from suicide. Not only that, the child become normal, and the child is doing normal things, and thereby the family also get back to happiness. This is what we got from the presentation. So homeopathy can do all these things if the doctor is doing following the rules of homeopathy, and always reading, making these kind of things, uh, studying, finding out the reasons behind the illness. That shows the relevance of case studies, not only the present situation, why and what is the reason behind these things. Usually,
Sir, if you permit, can I add something?
yes, definitely you can add
Yes.
something.
Yeah. You see, whenever we consider autism or something, we usually go behind the polychrist remedy. Like many of you suggested me to give Stramonium tarantula, and I also used to do this 15 years back. Now I'm practicing since 23 years, but I used to do the same thing 15 years back. But in last 15 years, I got the experience and the keynote of success. That is, metformin for diabetes is not the law in homeopathy. We are not going to maintain the patient with polychrist remedy. We are going to solve the cases with the particular remedy which patient wants. Why? Because you see, when you put the common symptoms of autism in the repertory chart, you will always get the same set of remedies in all patients, like polyphasia, polydipsia, polyuria in diabetes. And ultimately, metformin will be your remedy. But if you consider the symptoms of the patient, not the disease, then you will get a particular remedy which is actually made by universe for that particular patient. So your remedy selection should be like a mirror image between the current symptom of the child and mental status of pregnant mother during pregnancy. Thank you so much.
Yes, that's the reason why we used to say that homeopathy is nothing but mathematics, where you have to add something and you just have to uh, eliminate something. So, as you all know that for me, the total symptoms minus disease symptoms minus disease common to the symptoms common to the patients, and then you get the rare, peculiar, uncommon symptoms. And of course, those symptoms need to be considered along with the case itself. Then only you will get that we used to say, if you have 100 symptoms in your kitty, you'll just minus the disease symptoms. Of course, then naturally the 50 symptoms may be eliminated by that way. And after eliminating that much of symptom, then you go to the disease common symptoms common to the patients. Then sometimes you may get only some 7 to 10 symptoms. And then again, you eliminate some more symptoms, then you may get a 2 to 3 or sometimes 5 symptoms. Then you can go ahead with the repertorization, and then you can find the right remedy. Then with the, of course, some people say that you have to choose the right remedy as per the maximum symptom, but it is not so. But in homeopathy, after getting into the repertorization, you will have to opt the remedy in different situations and differently. What's your opinion on that, Dr. Kavita Chandak?
You see, Doctor, I want to add one thing, Dr. Dhanush,
Yes.
that Dr. Ware, one of the pioneer of homeopathy, he mentioned that we should collect the minimum symptoms of maximum importance. But our doctors has taken it in a wrong way, and they are collecting maximum symptoms of minimum importance. And that's why there is a miss. So collect only few important symptoms. Thank you. And could you please repeat your question, Dr. Dhanush?
Yes, yes, this is what this is what some people choose the remedy according to the after finding some 3 to 5 remedies, then you can choose either it is some people prefer the thermals in eliminating the symptoms, or color routing the remedy. Some people may go with the temperament to find the remedy, and some people may go with some other miasmatic way. So
Yeah, different
all those
approaches.
things. So
Yeah.
but still, you will have to read the right remedy. All in all these conditions, you can read the right remedy.
Dr. Dhanesh, here I would like to comment in a different way.
Okay.
Now, you see, like I am staying in Nagpur. I am a super chilly patient. Whenever weather changes, I first get affected. But the problem is that in Nagpur, because of the temperament and the environment of Nagpur, I have to keep my AC on 24/7 at least for 10 months out of 12. So now I cannot prescribe a remedy to myself as per my thermal reaction, because all the time I am sitting in the AC, though I am a chilly patient, because it is the demand of the environment. Global temperature has changed now. So whenever I consider any remedy, my spectrum or my approach is quite broad. First of all, pay importance to this important symptom, quality symptom of the patient. In psychiatric cases, the quality symptoms you can collect from the mind, and in other cases, we combine physical as well mental symptoms. So thermal reaction doesn't matter at all whether the patient is chilly or hot. Once you click with the correct remedy, remedy is the soul of the prescription. Once your soul is correct, the body will definitely follow its command. That's all.
Yes, exactly. Those who want to participate in the discussion, you may please raise your hand so that we will allow you to speak to Dr. Kavita Chandak, or you can ask your question by raising your hand. So please come up with your questions. It's a time for question hour. Is there anyone want to?
Something is in the chat.
No. The thing is nowadays raising hand because and this being, as you all know, the autism is one of the area where a lot. Doctor, what's your opinion on autism and vaccination? Because a lot of people, we can see that if you look at the USA or Western countries, 10 out of 1 out of 10 children having this kind of diseases. We can say that it is not sometimes. All these symptoms, all the reason behind maybe what you describe in this particular case, because these are the things that happens nowadays everywhere, and of course, vaccination has a big role in this. What's your opinion?
Of course. You see, I never go with what I read on the internet or in the books. I always go with my clinical experience. I have collected the data from various patients. I have videos where vaccination actually precipitated autism. And in Bogota in 2023 World Congress, I was invited there as an invited speaker, and I talked about vaccination and autism. I presented a lot of video cases there where I got autism precipitated by vaccination. So we cannot deny this truth that vaccination has a definite role in precipitating autism. Not only autism, if you will read the book written by Dr. Harris Coulter, an American person, he wrote the American vaccinations damaging American brain. And he mentioned there that how vaccination is not only related in creating autism, ADHD, or psychiatric diseases. Even he suggested that vaccination is able to create criminals in the society. So ultimately, vaccination, because of its heavy metal toxicity, because of mercury, because of aluminum hydroxide, they are really not good for our health. If you will read the drug picture of Merksol or alumina, the mental symptoms of them, they are not very pleasant drug pictures. You know, even Merksol has the typical picture, the syphilitic picture that everybody is my enemy, the whole world is my enemy, and only money is the god. This is the typical picture which represents the present condition of this planet. Is present in Merksol, and this mercury is present in the vaccination. So ultimately, you are going to get a lot of side effects with that, not only vaccination. But I won't claim that, yes, because of only measles vaccine, you are getting autism. No, I have patients having autism. I have a patient who suffered from autism after taking the vaccine for influenza. So there are different vaccines also, which are actually participating and contributing in creating autism.
Exactly. That's a very good answer. I invite Dr. Manoj to say something on that. Yes.
Thank you, Dr. Dhanesh. And definitely, it is the topic of discussion in the recent days. But the problem is that it's totally business, and the world is guided by the business people. So we cannot expect something will happen in favor of the common man. That's the most. Even wars are created for achieving certain ends, definitely. But if people are more aware of that, definitely, I think the social media can do a lot of role, can play a major role there. It will give some sort of relief, so some sort of solace, rather. And there is a neurodevelopment center in Trivandrum, Kerala, in the Vidyaraja Homeopathy Medical College. They have started recently, and they got a lot of success, including sensory park they developed there. And we have a discussion, we have a presentation there by Dr. Bindu once a couple of days back on this autism treatment with the help of the neurodevelopment center. And I think they got a lot of results out there. Definitely, homeopathy is a lot of medicine which can cross the blood-brain barrier. So we can have. Moreover,
Exactly.
we have hundreds of proved medicines according to the manifestations, not on
And
the.
Dr. Jha, Dr. Manoj, sorry to interrupt you. There are a lot of neurotransmitters present in our pathy also now, which we can use in the treatment of autism.
Yes.
I experienced the fast, quick, and significant result by use of neurotransmitter remedies, body own substance.
Definitely, homeopathy is not at all against such developments, because we can see in the introduction there, without disparaging the services offered to sciences that are accelerate to medicine. I am hereby dealing about the practice of medicine only. So homeopathy is not at all against this bacteriology, virology, or this accessory measures or the hygienic measures. It is totally in accordance with all the sciences. But unfortunately, some persons having minimum amount of reading, even though they are qualified, they always declare this is not right, no bacteria, no virus. But you can see that the spread of cholera. Then Hanuman advises the hygienic measures. He even comments that the doctors are often culprits in communicating disease by not washing their hands when examining a patient. then without washing the hand, then another patient. How the disease communicates? Definitely. So the contagion is there, but we are focusing on the immunity power of the patient by applying the law similars. That is a basic thing. So what is desperately needed is we need more studies, more reading, more intellectual persons, and ignited minds. Okay, thank you.
Yes, thank you. Thank you. Anybody else? Do you have any
Eh,
question?
Yes, since it being a different subject, maybe.
Dr. Tanesh, there is a question in the chat box. But
Yes.
Yes, please.
Yes, please. Please look at the chat box.
Please explain the success rate in diabetes, the medicines most helpful diabetes is the question.
Uh,
Just now
this
related to
question
the
is by Dr. Shamila. No problem. Whatever she asked, I would like to answer her. Beta, there is no success rate in homeopathy like to discuss. If you prescribe good remedy with good knowledge, success rate will be always 200%. So it depends upon a homeopath and his knowledge, the success rate, not about the name of the diseases. Understand? Next question is what, mom, from where we can get your book? You can put my name on the Google, or you can put the name of the book on the Google. Automatically, you will be redirected to the site of Vision, and you will get the book over there.
Okay. If anybody has any other question, having any question more, you can just raise or directly open your video. I think there is only a few minutes remaining. I think Dr. Abdul Salam, Sri Abdul Salam can come out and say a vote of thanks, as well as he can make a comment on the presentation also.
Sorry, Dr. Abida Salam will be there. She is there.
The person who is instrumental in bringing up Dr. KAVITA CHANDAK to this forum.
Yes. I actually presented twice before this session also. Last year and 2 years back around.
Yes, exactly.
Yes, but I couldn't come frequently. But I would like to come as time permits.
That's a great thing that always we need this kind of persons who are efficient, eminent, and dynamic to promote homeopathy. Because you are doing a lot of nobody can believe that a person and the caliber of 22 years of experience have written more than 300 articles in different forums, and not only that, she has written 9 books on that also. That is something great. The all books are different, having very high potential.
Dr. Abhijay is there to express order. Thanks, Dr. Tanesh.
Yes, 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 yes.
Hello, Dr. Kavita. Thank you
Hi.
so much for your wonderful presentation as always. And the case was wonderfully presented beautifully in detail. Each and every bit of it was taken care of. And your way of presentation, especially about the remedy selection, I need to really speak about it because you really explain like why you chose it. And like you said, mostly we all think of polycrest remedy. That is kind of a general notion. But how you showed how beautifully the case was, taken care of. And at the end, especially how the mom, even the change in the mom, that is, like you said, it's seen in most of these cases, how the parents or whoever is taking care of such children go through a lot of pain and struggles, and how they have to face a lot of struggles. So beautifully, I don't have words to say. It's as always beautiful. And thanks to all others participants who have been listening to this session throughout. So thank you all and have a good day. Thank
Thank
you.
you, Abida. Salam.
Tomorrow we will have a session from Dr. Mini Mehta from Delhi, and Dr. will be discussing about role of homeopathy in raising immunity. So with that we come. Thank you, Dr. Abida Salim and Dr. KAVITA CHANDAK, and those who participated in the discussion, as well as those who were actively participated in the presentation. And thank you all once again. Thank you.
Thank you so much.
We can see you. We can all see tomorrow at the same time. Good night. Thank you once again.
Yes, thank you so much.
It's over to Dr. Manoj to moderate the Malayalam session.
Dr. Shaila is there. Please make her co-host. Yes,
She has not yet opened the video. That's why I
yes,
couldn't.
she's
Yes.
open. She's there.
Yes, yes.
Yes, please.
Yes,
Doctor.
yes, I can make in a different way. Okay. Okay, welcome, Shaila Doctor. Because I was searching, but I couldn't find early.
She's there. She's there.
Okay, now we can put in a different